New at 10 tonight. Over the weekend, former President Jimmy Carter began home hospice care in Plains, Georgia. Fox 56's Jake Sarwar spent the day talking with care professionals about hospice care and joins us live now with more. Jake.
Aaron, good evening. After a series of short hospital stays, President Carter has decided to spend his remaining time at home with his family.
Former President Jimmy Carter decided to begin in-home hospice care treatments on Saturday instead of receiving additional medical intervention. At 98 years old, Carter is the longest-living former president in history. In a statement released by the Carter Center, Carter has the full support of his family and medical team in making this decision. In 2015, Carter announced that he had survived brain and liver cancer. In 2019, he had surgery for a broken hip and received 14 stitches after hitting his head. He was then treated for minor pelvic pressure before undergoing surgery to relieve pressure on his brain. Hospice care originated in the 1980s as a Medicare benefit for people who had incurable illnesses with an expected prognosis of less than 6 months. I spoke with Dr. Glenn Digwood, who specializes in hospice and palliative care, who says hospice is a team-based approach to caring for patients.
I think it's important for people to understand that, greater than 95% of hospice care is actually delivered in people's homes, where hospice care teams are coming to visit them.
Digwood says phrases such as entering or going into hospice can lead to a false representation, being that most of the service is done in a patient's home.
It's really medical care provided by a team of healthcare providers. So it's a really, truly interdisciplinary team consisting of obviously physicians, nurses, social workers, chaplains, pharmacists, physical therapists.
Beginning hospice can be challenging on the patient and the loved ones taking care of them. Alyssa Maria is the co-owner of Home Instead in Luzerne. She tells me that their care professionals are utilized to help the patients physically, but also emotionally with loved ones.
It is a very challenging time for families. It can be scary for them. They're not sure what to expect. It can also, to be there alone with the person can be very emotional.
Maria says that although when someone is receiving hospice care, it does not always mean that they will pass away. She says that in some cases, there is a possibility that a patient can be discharged.
Now, I did reach out to the Carter Center, and they said as of now, they don't have any additional updates on the president's health. Reporting live in downtown Wilkes-Barre, I'm Jake Sarwar, Fox 56 News, First at 10.